Good morning, everyone. Scott Maybor here with your Medicare Missive from the pond for Friday the 29th of May. It being the 29th means you only have a few days left to get a policy in for June 1st. This is going to have to be brief. I have to get to an appointment, and my lovely wife told me I didn't have time to do a walk and a video today. So we're going to make it brief. But really what I wanted to talk about today is not the deadline, and how people always wait till the last minute, but provider networks. So one of the people that I'm working with for a June 1st effective date, we had chosen a policy based on information that was online regarding the network, and unfortunately that information is incorrect. So the carriers have the doctor search or the provider search, and you put in your zip code and you look for the doctor, and the doctor comes up. But they don't promise that information is accurate. When you sign up for a policy and your doctor is not in the network, so we're talking Advantage plans or, in this case, an ACA plan, you don't have an open enrollment if you made a mistake, one, or the doctor subsequently leaves the network. So you could have signed up for a policy in January, and then in June, there's a large healthcare group in Rhode Island that just left, I believe, United Healthcare. It doesn't matter. If you chose your United plan in this case, based on your doctors from that healthcare network being in network, and they say as of May 31st, we're no longer in that network, you're out of luck. That is the biggest problem. There was talk of adding a special enrollment period, that if you lose your doctor because of a network change, you would have an open enrollment period or a special enrollment period to change plans, which makes a lot of sense because the networks, the providers, are not obligated to stay in for the full year, but you're stuck for the year in most cases. So the ways to avoid this would be, one, allow people to make a change. Two, go with a Medicare plan that doesn't have a network. So that would be another thing. And that's really it. I mean, you don't have a third choice. You do your best research based on what's available, but one, things change, and two, there's inaccuracies, and most of the carriers say, yeah, those lists aren't kept up to date. Well, if that's the tool they're giving you to use, that's a problem. So keep that in mind. In this case, for the case I mentioned, we need to either submit a different application or switch doctors. If we don't name a doctor, then they're going to assign, this was for the PCP, they're going to assign her one, which she can later change, but she likes her doctor. She wants her PCP in the network. So that's this morning's project after my appointment, to figure out what we're doing for her and her husband, to see what plans work. But pay attention to networks because they matter. I signed somebody up for a Medicare plan yesterday. She really wanted an Advantage plan, but she has a dozen doctors. She has some health concerns. She spends part of the year in Florida. And I said, do you really want to try an Advantage plan that's going to cover all 12 doctors, which they're all pretty much in the same network, so probably doable. Covers you both in Massachusetts and Florida. And what are your copays going to be based on your healthcare needs in comparison to simply paying a premium? And she said, well, let me think about that. Came back to me and said, yeah, I think the supplement or the Medicare plan makes more sense. So keep that in mind. Let me know if I can help. Have a great weekend. It's going to be pouring here tomorrow. Hopefully, it's always nice during the week and crappy during the weekend. So it is what it is. Enjoy. Thanks for watching. Let me know if I can help. Have a great weekend.